Alcohol intoxication, alcohol poisoning, or alcoholism. These are basically the general terms used for the alcohol intoxicated state, in which can be very fatal for the individuals. Now, we generally come across the acute and the chronic phases of this alcoholism. Acute is basically identified as the higher dosages and the lesser time duration of the fatality. And the chronic alcoholism is basically defined or determined under the bouts of the alcoholism in which there are periods of recovery in between, and the person stays immune in between. So these are basically regarded as the chronic alcoholism states. All of these are generally routinely examined by a forensic practitioner. How he has to deal with such cases of acute and chronic type, they're again very important. A lot of medico-legal aspects have been observed, and a lot of traumas, road traffic accidents correlate to these acute or even the chronic type of alcoholic states. So to diagnose these states is again very important. What are the diagnostic tests? On the spot tests even are identified, and they have been developed. For example, the breath tests and the blood tests and the blood sampling is taken and sent for the examination. So the diagnosis is again very important, and the treatments, of course, whenever we come across such cases, what is the type of management that has to be planned by the practitioner whosoever is working on duty. So the methyl alcohol intake is again very important. Whenever we observe that whether ethyl alcohol is more prevalent or methyl alcohol, it's basically ethyl alcohol, which is the drug of abuse and which is used for this by the chronic alcoholists to cause this chronic alcoholism states. So all of these will be discussed over here. First of all, we'll go through the acute alcoholism. What are the basic factors behind it? What are the diagnostic factors, and how are we going to diagnose deaths due to an acute state of alcoholism? And then the chronic alcoholism. A lot of organs are damaged due to these bad habits of chronic alcoholism, and these can be the diagnostic factors. Whenever death has occurred due to any chronic alcoholic state, there is going to be a lot of changes that has occurred to the body, and that can be diagnosed by the practitioner. And then we'll specifically discuss the methyl alcohol poisoning. Why is it important, and how do we deal with these cases? Talking about the modes of death in the acute alcoholism, the blood alcohol levels in excess about 300 milligrams per 100 ml. So this is basically the cutoff point that has to be kept by the forensic practitioners working out there. If we look at this diagram over here, it's basically the metabolism which is shown over here. So ethanol is basically in the presence of this ATH, it is converted to this lactic acidosis, and this ketoacidosis is taking place, and there is an increased triglyceride formation. So it is basically what is happening over here, and then ethanol is converted into this acetate. So it's basically the acetaldehyde that is the final product of this ethanol metabolism. So we have to keep this in our mind as well. In the peripheral tissues, what is happening is this ethanol is basically combining with this water and carbon dioxide and is converting into the acetaldehyde. So that is basically the final byproduct of this metabolism, and we have to keep this in our mind. So these are the symptoms that can be observed during this metabolic process is taking place. There is flushing, nausea, headache, and general discomfort observed by the patient whosoever is going in an intoxicated state, and the muscle weakness is also observed in such cases. There is a direct depressive effect upon the brainstem. So rather than just observing the excitement phase, we have to keep in our mind so that there is a depressive effect as well over here on the brainstem, and we have to keep in our mind that this brainstem is basically the center for the respiration and also the cardiovascular system. So this depression is going to be fatal for the person who is going in the intoxicated state. The secondary events such as the aspiration of the vomit. So the person is in such a deteriorated and in an unconscious state that he may even aspirate the vomit, and after the vomitus enters the respiratory tract, of course it can cause any kind of an asphyxiation kind of a death. So fatal trauma can occur, for example, the road traffic accidents can occur, or even tripping over in the washrooms can cause the deaths of such persons in acute alcoholic states. Now, the burns or the carbon monoxide toxicity. So the person is basically unconscious, so even he can cause burns. And if there is some sort of a gas leakage, it can again cause the carbon monoxide toxicity, because he won't be able to diagnose any states of any altered states of levels of consciousness, because he's already intoxicated with alcohol. Now, defining chronic alcoholism, it's basically the steady, regular abuse of the drug. There is a drug abuse stage. There is rather than intermittent binge drinking, which gives the tissues time to recover between the bouts of acute alcoholism. So the person gets immune to this alcohol intake, and he can basically recover between these bouts of alcoholism. There are a lot of autopsy findings in such patients, and there are signs of general neglect and malnutrition. Of course, he's in a deteriorated mental condition, so he'll be malnutrited, he won't take care of his diet, and there will be a chronic heart failure even observed in such people. Lesions in the liver, because liver is the major organ of metabolism. Heart and again the brain is primarily affected, because alcohol can cross the blood-brain barrier. You have to keep that in our mind. The neurons are bathed in this alcohol and its metabolites, and so the brain is going to be primarily affected as well. The liver is enlarged and there are fatty changes in the liver observed. So as I was already telling you that the liver is the major organ for metabolism, so it's going to be enlarged and fatty changes are also going to be observed over here. The surface of the liver is generally pale, greasy, patchy, yellowish areas are observed in states of the liver whenever it is sent to the histopathologist. Then there are severe cases of fibrosis and cirrhosis, and the liver size is generally decreased in such cases. Talking about the chronic alcoholism, the gamma-glutamyl transpeptidase are elevated in the liver damage. The alcoholic cardiomyopathy is again very important. What you can observe over here is that the heart is enlarged, there are patchy fibrosis with a variable mixed cellular infiltrate. Hypertrophy of the muscular fibers is observed in such a case, and the patchy necrosis, hyalinization of the tissues, and edema and vacuolization is again very important over here. Over here you can see that basically liver is affected over here. There is impaired utilization of the nutrients and increased degradation of the nutrients. So as toxicity is basically, it is going to empty the calories and cause the malnutrition, and the functional impairment is also observed in such people over here. Talking about the methyl alcohol, it's basically endogenous blood methanol concentrations, which are basically 1.5 milligrams per liter. So this is basically the cutoff point for its intoxication. The urinary formic acid concentrations is almost 12 to 17 milligrams per liter, and that is basically observed in the urine. So the urine samples are again very important. Heavy drinking of the ethanol is going to cause this poisoning, blocks the oxidation of the endogenous methanol. So this is basically the mechanism that is involving this intoxication, and the accumulation of the methanol, both endogenous and exogenous, at this level is very important to cause this intoxication. Again, you have to keep in your mind that if this intoxication, the medico-legal aspects are usually suicidal, homicidal, as well as accidental in these cases, and they have to be known by the practitioner himself. So in this section, basically, we defined the acute and the chronic alcoholism, as well as a comprehensive review for the methyl alcohol poisoning as well. That was the end of this section. Thank you for watching sqadia.com.